Memorial Hospital, the first hospital in Northeast Florida to offer patients aquablation therapy. It is a minimally invasive technique to treat benign prostatic hyperplasia, BPH. You're like, what's that? It's non-cancerous enlargement of the prostate. It's a common condition affecting 1 out of every 2 men over the age of 50 and 90% of men older than the age of 80. So let's talk about this revolution available at Memorial Hospital with Dr. Ali Kasrayan of Kasrayan Urology. Good to have you back here on the morning show.
Wonderful to be here.
So how does it work, and how does it differ from what has been traditional treatment up until now?
So traditionally, when you have a prostate that's enlarged, think about a prostate like an orange. You got the outside rind and you have the inside fruit. The inside fruit tends to grow after the age of 40, and how much it grows and how much it bothers you is variable and very individualized. So if the prostate is growing and causing problems, historically the standard of care is this thing called a TURP, or a transurethral resection of the prostate. You can use laser technologies to do the same thing. It's kind of like going in with a spoon and carving out the fruit. What this technology does is it uses 2 types of real-time imaging, multi-dimensional. So you do an ultrasound that looks at the size of the prostate. You can measure the portion that you have to open up, and then you're doing a cystoscopy where you look in the bladder with a telescopic camera. So you're looking at it in multiple different ways, and then you can program exactly what you want to open up, and in a 5-minute water jet ablation without any kind of electrical energy, it opens that channel up. So it's very precise, very accurate, and very reproducible. So you know exactly what you're doing.
It's robotic, it's targeted, and I assume that means fewer complications.
Yeah, so with this, the outcomes in terms of improved urination, a stronger force of stream, those have all been shown to be equivalent to the TURP, the standard of care. And for bigger prostates, bigger than 80 grams, which are very large, sometimes we would do a procedure called a simple prostatectomy, where you surgically open up that channel. For those patients, actually some of the outcomes have been not only less invasive with less complications, but better in terms of the outcomes they notice with a less invasive procedure.
Talk about how common it is. I assume that it's discovered during a guy's annual checkup.
With this, a lot of times men approach physicians for symptoms. You have trouble urinating, you have weaker stream, you're going more frequently, more urgently, you're waking up at night. So you approach your primary care doctor that eventually gets you to a urologist. You try medicines, but for a lot of men, the medicines may not always work if your prostate's too big. So you approach a surgical management, which a lot of men may be afraid of because of their concern regarding side effects, including sexual side effects. If you open up the prostate channel, you can decrease the volume of semen because the outflow tracts are there. This procedure has a much lower complication, about 4 times less than the other procedures.
So I think you told me you performed, what, half a dozen aquablations last week, and I know it's been done elsewhere. Reaction from the men who go through the procedure?
I'll tell you, with this, the minimally invasive nature of it is good. The urine tends to clear up very quickly in terms of the coloration, and the fact that you can offer a less invasive option to men that may be looking at either open or robotic surgery to open up their prostate is a wonderful option. And for me, from the physician's perspective, the precision and accuracy that you know exactly what you're trying to target and watching it open up in real time is amazing.
Anesthesia, general, local?
So we do a combination of general anesthetic, which is a mild general anesthetic to make sure you're comfortable, but also we've incorporated spinal anesthetics, so like a regional block to decrease discomfort afterwards, decrease opioid use, and their comfort with the catheter as they wake up from the procedure. So that's worked out very, very well in terms of patient comfort and outcomes.
And relatively new, covered by insurance?
So with the insurance aspect of these things, because it's a newer procedure, we actually go through a pre-authorization process to see that and have some answers with regards to that. The national company PROCEPT, which is the Aquabeam Ablation company, spends a lot of time with both us and the patients to try to help get coverage and an understanding for coverage from that standpoint. So I think this is going to revolutionize the way we treat BPH, especially for the larger prostates.
So if you have BPH, or if your husband or spouse has, your significant other has BPH, and you want more information, you can get more about the new procedure on news4jax.com. We will post this interview as well as a way to contact Dr. Kasrayan. Just look under the Live Healthy section.